Hi folks, I'm Dr. Chris Novak. I'm a pediatrician and a RIME pre-clerkship educator. This podcast will present an overview of child abuse and maltreatment. I have no relevant disclosures, and I've taken appropriate steps for copyright. Before we start, a note. Child abuse is extremely common. Many of us may have experienced or been exposed to child abuse in our lifetimes. Some topics discussed in this podcast may be triggering for learners, so please take care. There are resources available from the Student Advocacy and Wellness Hub and the AMA Physician and Family Support Program if you need support. After listening to this podcast, the learner should be able to, number 1, define the 5 types of child maltreatment. Number 2, consider when child maltreatment may present in a healthcare context. Number 3, understand the legal standards for reporting suspected child abuse in Alberta. Future podcasts will discuss the child welfare system in Canada, the long-term effects of adverse childhood experiences, or ACEs, and approaches to specific types of child maltreatment. Child maltreatment is defined as the harm or risk of harm that a child or youth may experience while in the care of a person that they trust or depend on, including a parent, sibling, other relative, teacher, caregiver, or guardian. Maltreatment may occur through acts of commission, direct actions taken by a person, or acts of omission, such as in failing to provide necessary care. Of note, the terms child maltreatment and child abuse will be used interchangeably throughout this podcast. There are 5 types of child maltreatment: physical abuse, sexual abuse, neglect, emotional harm, and exposure to family violence. Physical abuse is defined as the application of unreasonable force by an adult or youth to any part of a child's body. This can include harsh physical discipline, injurious behavior, burns, or poisoning. Physical abuse could present with unexplained bruises, fractures, or head trauma. There may be a delay in seeking care, or an explanation for an injury that is not consistent with a child's developmental level. Sexual abuse is defined as involvement of a child by an adult or youth in an act of sexual gratification or exposure of a child to sexual contact, activity, or behavior. This can include inappropriate touching, sexual acts, or exposure. Of note, children less than 12 years of age cannot consent to sexual activity under Canadian law, and there are specific legal criteria for consent for teenagers. This will be further discussed in a future podcast. Also, some children and adults with intellectual disability may not be able to consent to sexual activity. Adolescents cannot consent to sexual relationships with adults in positions of authority, such as teachers, coaches, or healthcare providers. Sexual abuse could present acutely with the disclosure of recent abuse or as a report of historic abuse from the past. In young children, it may present with atypical or inappropriate sexual behaviors, unexplained sexually transmitted infections, or genital injuries in children, all of which can be red flags for sexual abuse. Next, neglect. Neglect is defined as failure by a parent or caregiver to provide the physical or psychological necessities of life to a child. Examples include a failure of appropriate supervision, abandonment, or a caregiver not meeting the basic needs of a child, such as nutrition, housing, and hygiene. A specific subset of neglect is medical neglect. This is where a caregiver does not provide necessary medical care to a child, which leads to unmet healthcare needs. This could include missing appointments, not providing prescribed medications, or refusing medically necessary treatment or surgery. Neglect could present with poor weight gain, unmet healthcare needs, or an unclean or disheveled appearance. Of note, the definition of neglect does not imply an intent to harm a child. Many parents and caregivers are unable to meet their child's needs due to a wide range of structural factors that may not be their fault. However, if the child's basic needs are not being met, this is neglect. Emotional abuse is defined as adult behavior that harms a child psychologically, emotionally, or spiritually. Examples include hostile treatment, verbal abuse, or emotional neglect. Finally, there is exposure to family violence or intimate partner violence. This is defined as circumstances that allow a child to be aware of violence occurring between a caregiver and their partner or between other family members. Allowing a child to see, hear, or be exposed to violence in their home can have significant long-term harms and is also considered an adverse childhood experience, or ACE. Finally, medical child abuse is a complex form of child maltreatment that may include several types of abuse. This has been referred to many different names, including Munchausen syndrome by proxy, factitious disorder imposed on another, or caregiver-fabricated illness. Medical child abuse is when a caregiver falsifies signs or symptoms or causes direct harm or injury to a child. This may be due to a psychiatric condition in the perpetrating caregiver, or could be due to secondary gain. This is a complex topic, but could be considered when a child has persistent, unexplained medical symptoms, with an intense caregiver focus on healthcare needs that may seem out of keeping with a clinical presentation. A 2019 study found that almost 300,000 child maltreatment investigations were conducted across Canada that year, at a rate of 46.6 per 1,000 children. Looking at substantiated maltreatment investigations, the most common forms of maltreatment were exposure to intimate partner violence, followed by neglect, physical abuse, emotional maltreatment, and sexual abuse. Other studies show that 31% of males and 21% of females experience physical abuse during childhood, and that 12.8% of females and 4.3% of males experience sexual abuse in their lifetimes. These numbers likely only scrape the tip of the iceberg, as we know that many cases of child maltreatment are not detected or reported, and that many survivors do not feel comfortable sharing their stories. Structural racism and implicit bias have a complex relationship with child maltreatment. Rates of child maltreatment investigations are 3.6 times higher among First Nations groups in Canada compared to non-Indigenous children. The reasons for this are complex and multifaceted, but likely include intergenerational trauma, structural racism, and socioeconomic disparities. There is also data showing that other minoritized racial groups are also more likely to be investigated for child maltreatment. However, one study showed that if you adjust for income, there was actually no significant difference in the rates of substantiated abuse between any racial group. One study showed that abusive head trauma was more likely to be missed by clinicians in infants who were white and have two parents. This could lead to a delay in diagnosis and further risk to the child's safety. When thinking about child maltreatment, it is important to consider if implicit bias is impacting your decisions. It's possible that clinicians may be more likely to consider maltreatment in racialized or low SES families, and less likely to consider it in white or higher SES families. Both biases can have profoundly negative impacts on children. Child maltreatment can present in any part of the healthcare system, and healthcare providers need to have a low index of suspicion for maltreatment. Maltreatment may be first detected in a medical office, emergency department, inpatient ward, radiology department, or pathology department. Physicians are trusted professionals, and during your career, a child may disclose abuse to you. If you receive a disclosure of abuse, there's a few important things to remember. Let the child or youth tell you what happened in their own words without interrupting. Reassure them that it is right and brave for them to tell you and that it is not their fault. Avoid asking specific, narrow-ended, or leading questions. You may need to ask some specific questions to provide necessary, timely medical care to the patient, but your role is not to investigate the perpetrator. Forensic interviewing is a highly specialized skill, and asking leading questions can actually compromise an investigation. Document exactly what you were told and then report it. Recognizing and reporting child maltreatment is of critical importance. In Alberta, if you suspect a child could be experiencing maltreatment, reporting to Children's Services is mandatory by law. You do not need to be certain, but if you have a reasonable suspicion, you should report. The person who receives a disclosure or suspects abuse should call directly rather than deferring to a social worker. To report suspected child maltreatment in Alberta, you can call 1-800-387-5437 or 1-800-387-KIDS. Not every report is going to lead to immediate action, particularly if the maltreatment is remote or uncertain. Many children already have active files with multiple prior reports. The cumulative impact of multiple reports guides Children's Services to take appropriate actions. Possible outcomes include investigation, developing a plan to support the family, or apprehension. However, this is not the role of the physician to decide. While the goals of the child welfare system are to keep children safe and keep families together, there are many challenges and limitations of the system. Let's wrap up with a few key take-home points. Number 1. The 5 main types of child maltreatment are physical abuse, sexual abuse, neglect, emotional abuse, and exposure to family violence. Number 2. Child maltreatment is common and is important to consider in a range of clinical presentations. Number 3. If you receive a disclosure of abuse, listen without interrupting, minimize questions, and document the exact wording of the disclosure. Number 4. Reporting suspected child maltreatment is legally required by Canadian law. Thanks for listening.